Welcome to the Autism and Care channel. Here, we speak with responsibility, warmth, and knowledge about emotional health and neurodevelopment. If you care about the well-being of your daughter, sister, student, or any girl or woman living with autism, this video is for you. Why is it urgent and necessary to talk about women and girls with autism? Autism, or Autism Spectrum Disorder, ASD, has gained increasing attention in both public and scientific discussions. However, for decades, research and clinical focus have been mostly on boys. This is not a coincidence. Studies show that autism diagnosis is about 4 times more common in boys than girls. But this statistic hides a worrying fact: autistic girls are much more invisible. Many go years undiagnosed or are misdiagnosed with other conditions like anxiety, eating disorders, or personality disorders. This happens because autism in girls and women can present differently, more subtly and camouflaged, making it much harder to identify. This invisibility has deep consequences. Without a proper diagnosis, they don't receive necessary support and face emotional and social challenges without guidance or care. The impact on development, self-esteem, and quality of life can be devastating. Moreover, the lack of knowledge about female autism reinforces stigma and prejudice, delaying the building of a truly inclusive society. That's why dedicating time and attention to understanding the particularities of women and girls on the autism spectrum is a matter of justice and care. In this video series, we will explore these particularities, the causes of underdiagnosis, the emotional challenges faced, support strategies, and, most importantly, real stories that humanize this topic. If this reflection makes sense to you, please share your thoughts in the comments. How does autism manifest differently in women and girls? What science reveals? When we think of autism, we often imagine clear and marked behaviors, such as obvious social difficulties, restricted interests, and repetitive behaviors. However, these manifestations can vary greatly, especially among girls and women. Recent studies indicate that autistic girls tend to show a different behavioral profile than boys. One of the most notable features is the so-called masking or social camouflage. This means many girls develop conscious or unconscious strategies to hide their social difficulties by imitating socially normal behaviors or making an effort to fit in. This camouflage is a double-edged sword. While it helps avoid rejection and bullying, it consumes a lot of emotional energy and can lead to anxiety and exhaustion. Research published in the Journal of Autism and Developmental Disorders, Lai et al., 2017, shows this masking is more prevalent in females, partly explaining the lower diagnosis rate in girls. Additionally, autistic girls often have less stereotypical, restricted interests. For example, while boys may be fascinated by trains or machines, girls might be interested in animals, art, or literature, which is often mistaken for typical childhood interests. In communication, autistic girls may have more developed verbal skills but still struggle with interpreting body language, facial expressions, and social nuances, all essential for smooth social interaction. These differences make diagnosis more complex and require a sensitive and specialized eye to identify subtle signs. Understanding this diversity is fundamental to avoid late diagnosis, which can increase the risk of emotional and social problems throughout life. If you recognize some of these traits in someone close to you, please leave your comment. The impact of underdiagnosis and what it means for women and girls. Underdiagnosis of women with autism is a serious issue that directly affects their lives. Many girls and women spend years or even decades without the correct diagnosis, facing significant challenges without proper support. Without confirmation of diagnosis, they often receive mistaken diagnoses such as anxiety disorders, depression, eating disorders, or personality disorders. These alternative diagnoses frequently address only symptoms without recognizing autism as the root cause. The impact goes beyond access to therapies. It affects self-esteem, mental health, and personal and social development. Many women feel displaced, struggling to understand their own emotions and behaviors, constantly trying to fit in environments that were not made for them. Lack of diagnosis also hinders access to school, work, and healthcare accommodations, increasing suffering and social exclusion. Understanding and combating underdiagnosis is essential to ensure these women and girls receive the care and support they deserve. If you know someone who has been through this, please share your experience with us. Science and advances in understanding female autism. In recent years, science has made progress in understanding the particularities of autism in women and girls. Research points to biological, hormonal, and social factors influencing the expression of the disorder in females. Neuroimaging studies show that autistic girls' brains may present different patterns of connectivity and emotional processing compared to boys. These differences may contribute to more subtle behavioral manifestations and greater use of masking strategies. Moreover, social environment and cultural expectations about female behavior influence how symptoms appear and are perceived. For example, girls are often socialized to be more empathetic and develop social skills, which can mask signs of difficulty. This new understanding has led to the development of more sensitive diagnostic tools specific to girls and women, as well as intervention programs that consider their unique needs. Science is opening important paths so that diagnosis and care become more precise and humane. If this information resonates with you, please leave your comment. Emotional and psychological challenges of autistic women. Living with autism in a world that still does not fully understand this condition can be extremely challenging for women and girls. Many face high levels of anxiety, depression, and social isolation. The constant effort to mask symptoms and adapt to societal expectations can lead to burnout, intense emotional exhaustion. Masking requires a lot of mental and emotional energy, which is often invisible to those around them. Furthermore, misunderstanding from family, friends, and health professionals can increase feelings of loneliness and rejection. Many women report feeling unheard or not taken seriously, worsening their suffering. Recognizing these difficulties is essential to provide appropriate support that addresses not only autism symptoms but also mental health and emotional well-being. If you have felt this way or know someone who has, please share with us. The importance of early diagnosis and specific interventions. Early diagnosis is crucial for improving the quality of life for girls and women with autism. When identified early, they can access interventions that respect their particularities and promote their holistic development. Interventions may include therapies focused on social skills, emotional regulation, communication, and self-esteem building. Family and school involvement is essential to create a supportive and structured environment. Additionally, professionals must be trained to recognize the specific manifestations of female autism and adapt their methods. Late diagnosis can lead to serious consequences such as worsening anxiety and depressive disorders and missed educational and social opportunities. If this topic touches you, write "strength" in the comments. The relationship between autism, gender, and identity. Many autistic women explore their gender identity in complex ways. Studies show a higher prevalence of transgender and non-binary individuals within the autistic community than in the general population. This diversity highlights the importance of an inclusive and respectful perspective that embraces all ways of being and expressing. Understanding these intersections helps combat prejudice and offer more effective support. Encouraging open dialogue about gender and neurodiversity is fundamental to ensuring the emotional health and well-being of these women. If this reflection resonates with you, please share your thoughts. Real stories. Inspiring lessons. Listening to autistic women's stories is a powerful way to humanize female autism and show that each journey is unique. Many share that receiving a diagnosis brought relief and self-understanding, allowing them to view their differences not as flaws but as part of their uniqueness. These stories also highlight challenges such as facing stigma and fighting for rights, but above all show the strength and resilience of these women. If you have a story to share, please write to us in the comments. How families, educators, and professionals can support autistic women and girls. Support should be based on respect for individuality and the specific needs of autistic women. Families can help by creating structured routines, offering space for emotional expression, and seeking knowledge about autism. Educators can adapt teaching strategies to favor learning and inclusion, respecting each student's style and pace. Health professionals should invest in ongoing training for accurate diagnosis and intervention. This collaborative work is essential to ensure autistic girls and women have quality of life and real opportunities. If something worked well in your experience, share it with us here. Promoting inclusion and empathy for autistic women in society. True inclusion goes beyond physical accessibility or curricular adaptation. It requires cultivating empathy, breaking down prejudices, and valuing neurodiversity in all its forms. Visibility of autistic women helps dismantle stereotypes, showing that the spectrum is broad and diverse. Awareness campaigns, inclusive public policies, and anti-discrimination education are powerful tools for this transformation. If you know initiatives like these, please tell us. Resources and support networks for autistic women and girls. There are organizations and groups dedicated to supporting autistic women, offering reliable information, social groups, and psychological support. Participating in these networks can strengthen the sense of belonging, broaden knowledge, and facilitate access to services. Seeking specialized professionals and connecting with others on the spectrum are important steps for growth and well-being. If you know any valuable resources, please share in the comments. Conclusion: acceptance, recognition, and hope for autistic women. Women and girls with autism deserve to be seen, heard, and valued in their entirety. Diagnosis, specialized support, and an inclusive society are pillars for them to thrive and live with quality and autonomy. Every story, every challenge, and every achievement are part of a journey that must be walked with empathy and respect. Subscribe to the Autism and Care channel. Share this video with those who can benefit and help spread knowledge and acceptance. We are in this journey together.